Good morning. Thank you very much to giving me the opportunity. So, today my talk will be on efficacy and tolerability of single fraction radiotherapy for spinal bone metastasis in a low middle income country setting, a prospective study. So, according to the American Cancer Society, around 400,000 new cases of malignant bone metastasis are diagnosed in United States each year. Most commonly affected part of the body in bone metastasis is axial skeleton, with vertebra having the highest metastatic frequency. Radiation therapy has been proven to be the main indication for treating vertebral metastasis over many years. And the most commonly practiced regimen are 8 gray in single fraction, 20 gray in 5 fraction, and 30 gray in 10 fraction. And pain response rate have been found over 60% of the patient with complete pain relief in 20%. So what was the rationality? Because in Bangladesh, there are a large number of patients have been found with metastatic cases in government center, and there is a huge waiting time. So if we treat a multiple fraction in bone metastasis, we have there is a potential chance to treat less number of patients who have potentially curable disease. And also, the multifractionated regimens are not convenient for the patient with vertebral metastasis, as hospital visit is more and these are more costly. So, single fraction palliative RT can reduce the cost, lower the hospital visit, and reduce the machine queue, so that more patient can be accommodated for radiotherapy in a shorter time in a low resource setup. So, objective of this study was to compare the effectiveness and toxicity of 8 gray in a single fraction for painful vertebral metastasis with other two types of fractionation schedule, 20 gray in 5 fractions and 30 gray in 10 fractions. So, this was a prospective non-randomized study conducted in National Institute of Cancer Research in Hospital from 1st July 2022 to 30th June 2021 upon the histologically diagnosed case of primary cancer with having radiological evidence of vertebral metastasis, and sample were selected by purposive sampling technique with a sample size of 90. And primary outcome of this study was pain response, and secondary outcomes were toxicity, improvements of symptoms other than pain, and overall survival. So, the inclusion criteria were histologically proven cases of primary malignant disease with radiologically and or histologically proven case of vertebral metastasis, patient more than 18 years to 75 years, Eastern Cooperative Oncology Group performance status 0 to 3, and the exclusion criteria were patients having spinal cord compression, vertebral collapse or compression fracture, more than 3 involved vertebra, vertebral metastasis associated with visceral metastasis or any other bone metastasis, previous radiotherapy to the indexed site or postoperative cases, and patient who received radio chemotherapy or any other systemic therapy within 20 days of radiotherapy. So, patients were treated with two-dimensional conventional radiotherapy. X-ray simulation was done, and patient treated in prone position with prone headrest as an immobilization device, and target was delineated as one vertebra above and one vertebra below, with the lateral border was delineated at the transverse process, and 6 MV energy was used. So, patient's pain was evaluated with the visual analog scale, and pain response was assessed by International Bone Metastasis Consensus Definition 2012. All other symptoms like improvement of walking ability outside home, improvement of sleep difficulty, and general daily activities were recorded on a scale of 1 to 4, where 1 indicated not at all, 2 indicated a little, 3 indicated quite a bit, and 4 indicated very severe. And reduction of score 1 was considered as improved. All toxicities were measured according to the NCI's common terminology criteria for adverse event, version 5. So, patients were evaluated pre-treatment, during treatment, and after treatment with history, physical examination, and relevant investigation. And after treatment, patients were followed up at 4 weeks, 8 weeks, and 12 weeks at the end of radiotherapy for toxicities and treatment response. So, most of the patients of this study were from the age group 51 to 60. Male sex was more common, and Lung cancer was the most common primary site in this study in the all study groups, and followed by breast and prostate. So multiple vertebra was more common in each of the fractionated regimen, and lumbar vertebra was the most commonest site of involved vertebra, followed by thoracic and sacral cervical vertebra. So most of the patient had poor performance status like ECOG2 and ECOG3. So this was the trends of pain reduction of the different fractionation group. Like the red one is for 8 gray, yellow one is for 20 gray, and the green one is for 30 gray. So the trends, these three lines are likely fallen over each other. So this means that pain reduction trends were similar in the three groups. And mean duration for first pain relief was 9.38 days for arm A, 9.71 days for arm B, and 9.55 days for arm C. And the difference was not significant. And overall response rate was 70% with single fraction, 67% with 20 gray in 5 fraction, and 70% with 30 gray in 10 fraction, and the difference was not significant. So all the patient with different study groups showed equivalent efficacy in reduction of symptom other than pain, like walking outside home, sleeping difficulties, and general daily activities. So this Kaplan-Meier curve showing the overall survival of the different study groups, and the median overall survival with patient received 8 gray was 7 months, with 20 gray was 6 months, and with 30 gray was 7 months, and the difference was not significant. So there was no grade 3 or higher toxicity was observed in this study. So GI toxicity and genitourinary toxicity actually more common, but the interesting thing was patient who received multifractionated radiotherapy, especially 30 gray, who had more skin toxicities than single fraction or 20 gray in 5 fraction. And all other toxicities like GI toxicities, nausea, abdominal pain, vomiting, diarrhea, dysphagia, every kind of GI toxicity was higher in the multifractionated group and lower in single fraction, but although the difference was not significant. So in conclusion, we can say single fraction radiotherapy, 8 gray in a single fraction, can equivalently relieve the pain and other symptoms associated with vertebral metastasis. And the toxicities, fewer skin toxicities were observed with 8 gray. And I think we should practice single fraction in our country in a low resource setup, so we can treat more patients who have a potentially curable disease. And I am glad to announce that my paper has been accepted in the supportive care in cancer recently, and thank you very much.